Thank you for wanting to learn more about the dance medicine services at Back and Step Physical Therapy. My name is Dr. Alyssa Arms. I am a physical therapist and the owner of Back and Step PT. Now, this video that you're about to watch is going to go much more in depth about all of the services that I offer for dance medicine, more than what you see on the website. That's a teaser for people who want to learn more. This is the details of all of it. So let's first talk a little bit more about who I am and my background so you know why I love working in the dance medicine world. First of all, my education is as a doctor of physical therapy from the University of Colorado. I also am a board certified orthopedic clinical specialist, which basically means that I'm a specialist in all things bones, joints, ligaments, muscles, all of that kind of stuff. Some current roles that I'm fulfilling, of course, like I said, owner of Back and Step PT. I'm also adjunct faculty for the University of Colorado's physical therapy program. I'm a guest instructor at the University of Northern Colorado for their Dance Education Master of Arts program. I'm also a guest instructor at the Colorado School of Traditional Chinese Medicine, and I'm on the advisory board for the Cherry Creek Innovation Campus for their pre-PT and OT pathway. And then, of course, dance experience. I have over 30 years of dance experience and training, starting at the age of 3. You can see one of my early pictures on there. I've been trained in ballet and point, jazz, tap, hip hop, salsa, and West Coast swing. And in fact, in West Coast swing, I've been an active national circuit competitor since 2010. Some important memberships to mention here too. I'm a part of the American Physical Therapy Association, including the Performing Arts Special Interest Group. I'm a member of the National Dance Education Organization and regularly present for the Colorado chapter. A member of the International Association for Dance Medicine and Science, or IADAMS. Members of the Bridge Dance Project, Dance Medica, and Doctors for Dancers. Let's first talk a little bit about physical therapy, rehab, and wellness services. Now, this is what most people think of when they think of physical therapy. Someone comes in with an injury, pain, or after a surgery to get an evaluation. We go through to see what all is contributing to what's going on, and then come up with a plan to get you back on track to being a happy and healthy dancer once again. This will include things like hands-on treatments, perhaps treatments like trigger point dry needling if that's of interest to you, prescription of home exercise programs, and ways to do self-care at home to make sure everything is on the right track to get you back to your goals. I also offer some wellness services. This is where things start to look a little bit different. Let's talk about some of those services. First, on the left of the screen, you see our Performance Boost program. What this is a way to work on improving performance, fitness, technique, and so much more. You come in, we figure out what your goals are, where you're starting from, how much time you want to dedicate to an exercise program for home. Then I go away on my own time, come up with a program that is customized to all of that information that you share with me, and then create this 1-month program. It has suggested schedules as far as what days of the week or how many days of the week to do certain exercises. It may be matched around certain classes that dancers are taking to make sure that we're not doing too much work in a certain area on a given day. And it gives progressions throughout that month. The goal is that you work with that program for at least a couple of months, getting a new program each month to really get you on track with your goals. We get back together, go over the program so that you're comfortable with all of those exercises, and then continue on your own during that time. In the center is the pre-point assessment or point readiness assessment. For this, dancers come in and spend about 45 minutes with me. We talk about dance history and the fact that the dance teacher has recommended that the dancer starts on point. During that assessment, we go through all kinds of range of motion assessments, strength checks, balance checks, and go through some technical movements from dance, specifically from ballet, to make sure that everything is pointing towards that dancer being healthy and safe to move on to point. By the end of it, I give a recommendation as to whether or not things are supporting that idea of going on to point, or maybe they need some more time. If there's anything that's falling outside of expectations, I also give recommendations of what to work on to help improve their safety to get them on point sooner. I can also put together a report that gets shared with the dance teacher that referred them. Lastly, on this screen, you see the annual dancer physical. This is like an annual physical, but specific for dancers and way more thorough than anything you'd get at your doctor's office. This is a 90-minute assessment. We check literally head to toe. We check range of motion in the neck, the shoulders, spine, hips, all the way down to the feet. We also check strength in all of those areas, assess balance, stabilization. We even check things like cardiovascular fitness and endurance testing. So again, with that, I put all of that information together, come up with a report that the dancer gets to learn more about what they could be working on and the areas that they're excelling in right now. We get back together to go over all of that and discuss any recommendations. There may also be recommendations to work with other kinds of professionals like nutritionists, Pilates instructors, personal trainers, lots of different folks that could be included in that. And I use my networks of dance medicine specific providers to help get you connected to people who really understand dancers to get you, again, back to those goals. Besides that, I also offer something I call dancer recovery programs. Now, this is great for a dancer who is dealing with a certain problem that wants to do more on their own, isn't really looking for a highly customized option at this point. Right now, there's only one offering within this, but I am working on others. This one focuses on pain in the plie. So as you could have guessed, this is for dancers who maybe are dealing with some knee discomfort, maybe feeling like their plies aren't as strong as they would like, they can't go as far as they would like. So this is an 8-week online program. You get guided week to week through a self-paced course that takes you through a list of exercises for that week and progresses each week. By the end of it, the goal is that you're no longer having the trouble that you were, and you've reached the goals that you're looking for. Others will be offered for other body parts and other complaints of what might be going on. So keep an eye out for those. I also offer Backstage and convention services. Let's talk a little bit about the options available here because there are quite a few. First of all, for Backstage services, what this typically looks like is setting aside time to work with dancers before a show or major rehearsal. What often happens is dancers will sign up for a 15-minute time to get work done and then move on to the next dancer. Some companies also choose to have me backstage throughout the show. So if there is an injured dancer who's just trying to get through the show as safely as possible, or someone gets injured during the show, they can get very quick and immediate care backstage. For convention services, it's a similar idea, except I'm on site at a convention or competition. A lot of times I'll set up in the hallway or in a room, whatever makes sense for where you're at and who all it's being offered to. I, again, offer sessions that can be in increments of 15 minutes for that to address whatever the dancer needs. Maybe they need help warming up and stretching out before they compete. They're dealing with an injury and, again, want a little bit of help to get through the weekend with that injury. Or they get a brand new injury and want someone to look at it and start working on it right away. The other thing to talk about with this service is there are different ways that people choose for payment of it as well. Sometimes the company will pay for me to be on site and offer services to whatever number of dancers we agree upon or whatever the setup is going to be. And in other cases, I'm on site and the dancers pay directly for the services. So a lot of options when it comes to anything on site. I also offer seminars. So I love coming and talking to people, whether it's in person or virtually. There are lots of different topics that I have spoken about as well. You can see some of them here on the screen. but topics can be completely customized based off of the audience and what you're wanting to achieve by asking me to speak to that group. I've done presentations for dancers as young as, maybe about 8 or 9 years old, dance parents, and or dance teachers and educators. As far as topics being customized, let's say that you have noticed a lot of your dancers are dealing with ankle sprains right now, and you want to learn more about how to prevent that in the first place and get the dancers stronger so that that doesn't happen again. I can create a program like that if it's not on my list and do the presentation for you. These presentations can also be customized on the amount of time that you want. So they could be as short as 15 or 20 minutes, depending on the topic. And I even teach in my Master of Arts course, a 12-hour course. So we really can span whatever length of time you want to have covered. I also offer a variety of ebooks to some of my dancers. So I have these 3 that talk more about injuries and exercises, prevention. And then I have some that were actually created by a registered dietitian talking about some nutrition tips. A lot of these are geared towards nutrition for heavy dance days, rehearsal days, recitals, performances, competitions, all of that good stuff. So there's definitely opportunity to learn through ebooks as well for my dancers. If any of this sounds interesting to you and you want to learn more, you want to see about having me work with you or your dancers, here is all of my contact information. There's the address, phone number, email, and website. You can also find me on Facebook, Instagram, and YouTube, all under Back in Step Physical Therapy. So I hope this provided some great information for you and answers a lot of questions that you might still have. But let me know if you'd like to work with me, and I'm looking forward to getting in touch with you.